What? Hello.
Hi, Niranjan. I'm
Okay.
Lisa.
Hello.
Lisa, hi.
So if nobody else finds out their way here, then we can go to one of the others.
Okay.
Hello. I still can't hear you, Christine.
Oh, sorry, there we go. Hello.
Yeah, now we can hear you, yes. So it's just the three of us, looks like.
Yeah.
It's a very different experience from teaching machine learning where the class is so full.
Well, I'm probably the person who doesn't know anything about it because I'm an occupational therapist by background. So
Right. So us two, we both actually teach the machine learning course.
Yeah.
So hi, Indu.
Hi, Indu.
Hello.
So maybe we'll just give another minute to anyone who's looking for the spreadsheet still. So is someone nominated to be a scribe, a note taker?
The links don't work for me.
Because so Age said, she asked me to police the meeting, which is now going to be very easy. There are only four of us. But she also said there's someone to make notes assigned to this. Do you think they might be in some other room? Like our undergraduates did, Christine, or MSc class used to do. How did we figure that out?
I thought she just said one of us keep notes, but the link doesn't work for me. It seems to be broken, so I can't open the Google document.
Yeah, same for me. It seems to link to some local drive and I can't make it work.
Right.
Yeah.
I guess the link in the chat kind of works. I'm able to see it now. Is it the Word document with example questions to consider? Yeah, okay. Yeah, I can help with the notes.
Okay, so I guess we'll just start chatting a bit and then maybe go and see what some of the other groups are. So this is going to be easy. Liesl, is that the name for you?
Yes, yeah.
Is that the name in the Sound of Music?
It is. Well spotted.
Okay. so if you could tell us who you are, and the three of us are in ECS, and
Yeah.
Christine and I actually teach the Foundations of Machine Learning course together.
Okay.
And Indu is a recently joined lecturer in our department, and she just spoke earlier. So we all know each other quite well, and so okay.
So I'm a lecturer in the School of Health Sciences, and I'm an occupational therapist by background.
Right.
I finished my PhD a couple of years ago, but one of the things I was really interested in was using sort of real-time assessments of subjective experiences of fatigue and data from wearables to track fatigue after things like brain injury initially, but there's lots of other applications. Partly because, well, the way we do it at the moment in clinical practice is really flawed. It's, you know, fill in a bit of a diary, try and remember what you did. So there's all that, you know, that's kind of some of the project that I'm working on. And I guess in the longer term, when I talk to people with brain injury, what they're really interested in is, can any of this data be used to sort of predict when they're going to be tired or as their fatigue is building? Because they can't see it themselves. They say, it just hits me like a wall, you know, and then I'm done. Then I have to sleep for hours. Or so there was a lot of interest, and for carers, about like an early warning. You know, is there information that could be gathered, whether it's the subjective as they're entering data? So I've got at the moment using real time, it's called ecological momentary assessment. So it pings them and they say, this is how I am at the moment and this is what I'm doing, and combining that with wearables to look at things like physical activity and sleep and data. But I haven't got any further, you know, it's very descriptive at the moment. And I think that some of the longer term view is there a way of making this more predictive so that people could nip their fatigue in the bud a little bit more?
So is what you are looking for, does that overlap with what's in, what's it called, CPRD, clinical practice research data? This is GP level data across the country, maintained by NHS, not NHS, but I'm sure they have subcontracted with some company.
No, no, it doesn't. It's, you know, at the moment it's just looking at it. What we have is they use an app at the moment and it's paired with a wearable to collect the data.
Right, okay.
That's what we have, yeah. Well, it's a research platform, so it's not a bespoke app. I'm using a research platform, yeah.
Okay. And by wearables, do you know what it measures now?
Well, I mean, we're looking at, we're trying to use a commercial wearable so that it's accessible. So at the moment, I've got looking at Fitbit HR, and we're just thinking about literally levels of physical activity, step count, intensity, sleep duration, and then matching that with their subjective reports. And we also have a short reaction time test, which can be a proxy for mental fatigue. So some of this needs more testing, but these are the sorts of ideas about how you package together people's subjective feelings with what they're actually doing physically against some parameter of a short cognitive test to see whether there are changes in their cognitive ability as they fatigue. And does that all pull together to sort of give a sense of how their fatigue is changing over time, and are there patterns in the data that would say, actually, maybe you need to rest, you know, actually your fatigue is really building, maybe now is the time to rest. Or so I suppose building into strategies in the longer term, but that's what I'm thinking about.
Okay. And what sort of patients cohort sizes do we have on this?
Well, I mean, brain injury there's about 300,000 people admitted a year with a brain injury, because it's stroke and acquired brain injury, traumatic infection. And the evidence seems to be that almost half of people have fatigue longer term. So sort of in terms of the country or even globally, there are massive numbers of people with brain injury living with fatigue. Sure, yeah. It's a really under targeted area, particularly, and there's no effective treatment. There isn't evidence for effective treatment. They can't give them a drug, it doesn't make it any better.
But presumably we can't get national level data on this, right? Unless someone has a national level effort.
Yeah, no.
So what would be the kind of size if we acquire this in Southampton?
I don't know. That's what I have to. These are the sorts of things I need to think about.
Okay. Yeah.
And I guess that, you know, it's about how we would kind of what that size population would need to be and how we would recruit them. And I would think it would need to be more than Southampton. It would need to be further across the country. And I'm thinking really not necessarily inpatients, it's people in the community. So it's people who actually have been discharged from hospital and now they're out. But what happens is they can't go back to work.
Right. Yeah.
And of course, the other population that's very much in the news at the moment is the long COVID population. Similarly, fatigue is a huge problem for people with long COVID. And those numbers are much higher.
They're much higher, yes. Yeah.
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 And that cuts across all age groups as well now, right?
Yeah. Yeah. Yeah, it does.
So is there effort on long COVID in Southampton?
I'm part of a different project, but Southampton aren't part of that apart from me. So this is a long COVID symptom tracking project that's running at the moment.
Right.
And they're looking at recruiting about 300 people to that study. That's sort of 300 with attrition. So that's the number that they need. And collecting data on longitudinal data on their symptoms and things like heart rate variability, physical intensity, sleep, that sort of thing as well.
So for that data collection, you mentioned that ideally you would like to move it into the real environment where you keep monitoring people at home and shopping, things like that. But would you start it off in a control environment or would you instantly go to the full practical scenario?
I think what we've done with the COVID is it's a full practical scenario. They're at home. So this is about monitoring people at home. And that's the kind of thing that I've done so far. It's really just going straight out into using it in the community and people's everyday lives, because that's where it will fall apart if it doesn't work. Yeah.
So in those scenarios then, is there any way to record or gauge context of what has happened prior to the onset of fatigue? So for example, if someone has exercised very vigorously, you would expect that probably there's some kind of level and then peaks up again. So is there any way to get that contextual information as well?
Well, that's part of the analysis that we're eventually doing with the long COVID cohort is time lag analysis. So the data from the wearables that they'll be using, and we also have a research standard accelerometer that they'll be wearing as well to compare with the Fitbit data. But they'll be looking at time lag analysis. Is there a relationship between activity and fatigue and other symptoms, because fatigue's not the only symptom, or is it the nature of what they do? Is it the length of time that they're doing it for? Is there a combination of things that actually mean that their symptoms exacerbate? Is it their sleep quantity or duration of sleep that is related to the symptoms? And vice versa, actually, what effect does symptom exacerbation have then later on in terms of people's behaviours around activity and sleep?
Interesting.
Yeah.
Out of curiosity, I think Niranjan implicitly asked the question: how many test subjects are you looking to get?
Well, for the COVID one, we're trying to recruit 400 with an aim that we'll be successful with 300. That's the sort of, and they're being tested at 3 points. So we have a week of longitudinal data. So some of that is continuous data. The subjective reports are 5 times a day. And so each person will have these 3 time points with a week's data.
So this being at a very early stage of thought or activity, I suppose, so normally the kind of interactions we have with medical colleagues I have starts by saying, okay, I have all this data. Come on, let's do some magic with it type conversation. That's how the conversation starts.
Yes.
But this is at an early stage, which is actually much more interesting because you can define the scientific question and develop the data gathering activity around that right from the beginning. And that would be very interesting to talk about, actually. Indu, is this something that would interest you?
Yeah, sorry, it took some time to unmute.
Yeah, yep, it
Yeah,
does. Yes,
I
yes.
think one of the interesting problems that I've been thinking recently is about burnout symptoms. So the thing is, the progression towards burnout is not very well defined, in the sense that we don't have critical key points along the path, which again causes us to think more about how to define fatigue from the neuroscience perspective, from the EEG markers and things like that. So probably for me, I was just putting it out there. I'm just thinking out loud here. So that if there is a way to define some critical key points towards burnout, or yeah, fatigue, or the where the collapse is happening, and if we can define the key points, but even if the timeline to reach the stage could be different for different people, if we model it based upon the key points, probably that will give us some answers. So that's what I was thinking. Yeah, and it would be great to have some access to the data, of course.
So yeah, so I mean, this is an early stage, which means we can get involved
Yeah.
in at the time of collecting the data. Yes. So we have been asked to come back, but Liesl, you could just drop us an email, and we
Sure.
could touch base
Yeah.
in the next couple of weeks. I mean,
Okay.
you're in health science, just next door. Are you next door to us or at the hospital?
I'm at building 67, so just next.
Okay, that's across the road from us. Yes. Yeah.
Yeah.
Okay, so we'll meet up.
Okay, lovely. Thank you very much.
Let's
Thank
go
you.
back to yes.
Thank you.
Okay.
Thank you.